The Mason Square Health Task Force is a great example of a community group who's decided not to just look at health outcomes, but what are the key social determinants of health that really shape the health and well-being of residents. There are things like food access, access to jobs, transportation, things that we traditionally think about as sort of quality of life issues, but that really have a tremendous impact on the health of residents.
Mason Square is a very poor neighborhood. We have a number of fast food restaurants almost on every corner, but we don't have a major grocery store in our community, nor do we have any smaller stores that, provide fresh vegetables or fresh fruits, fresh produce to us. So,
poorer communities often become food deserts, areas where healthy food is hard to get. Areas like that also combat low employment, bad schools, and environmental toxins. These factors disproportionately affect African Americans and Latinos, who to this day earn less than other ethnic groups in the U.S.
Is a food desert, if you will, when it comes to healthy food.
One of the key systems change issues has to do with racism. Then you're really talking about what never gets talked about. We'll call it health inequities. We'll call it health disparities. But we're not going to say it's based on, racism and the underlying causes. If there's a problem with food, we're going to deal with why is it that no one will place a supermarket in this area? Why is it that when I go into the local store, it's disgusting? Why is it so dirty there?
Residents of the country, whether we're talking about asthma, diabetes, heart disease, breast cancer mortality, people of color within communities fare far worse than their white counterparts.
Our long-term vision is for a world and a community where we can't predict someone's health by where they live or by the color of their skin. We understand that health is a human right, and we're excited that communities are working toward that end.
Public policy has a large influence on community health and disparities in health. So federal, state, and local laws have a large impact upon the health status of people. Recently, there have been attempts for policy change to limit or reduce disparities in health. The Department of Health and Human Services has several initiatives like the Healthy People 2020 campaign. Michelle Obama has her Let's Move campaign, and there's also an initiative to try to reduce influenza through vaccinations in lower income communities.
Social justice is a public health issue, and ultimately racial equity and social justice are really essential for eliminating health disparities. We funded a total of 15 grantee communities across New England to develop new approaches to thinking about health disparities.
We need to subsidize better food options in very poor neighborhoods and investigate exercise and diet in Native American populations. We are proposing to pretty much advertise campaigns that will be showing a clear disparity in doctors' usage, and pretty much also recommending that African Americans go to better doctor's office, better hospitals than the traditional ones.